Hello, friends. I hope all of you are fine and in great health. I am Dr. Puneet Agarwal, consultant dermatologist, practicing dermatology for past 19 years. I am a private practitioner with clinics at two locations in East Delhi, Krishnanagar and Mayur Vihar. Today we are going to discuss about eczema and I hope it will help you in understanding the disease better. Eczema is a group of inflammatory skin conditions that are characterized by itching, redness, scaling, and sometimes fluid filled lesions. The term dermatitis and eczema are many a times regarded as synonymous, but there is a fine line of distinction between the two. The term dermatitis include all types of cutaneous inflammation. So, all eczemas are dermatitis, but not all dermatitis are eczemas. Eczema is very common and accounts for a large proportion of all skin diseases. According to one estimate, approximately 1.8% of the world population is suffering from one or the other forms of eczema. Eczemas are classified as endogenous and exogenous. The exogenous eczemas are related to clearly defined external trigger factors, although inherited tendency can also play a part. The common exogenous eczemas are irritant dermatitis, allergic contact dermatitis, and photodermatitis. The term endogenous eczemas implies that the eczematous condition is mediated by processes originating within the body. The important types of endogenous eczemas are atopic dermatitis, seborrheic dermatitis, steatotic eczema, discoid eczema, hand eczema, gravitational eczema, and eczematous drug eruptions. Eczema can begin during childhood, adolescence, or adulthood. Certain patterns of eczema can be seen more commonly in some particular groups. For example, atopic dermatitis is more common in young children. Discoid eczema and steatotic eczema is more common in elderly, and irritant head eczema is quite troublesome in factory workers. Eczema is not contagious, means one cannot catch it from someone else. People develop eczema because of a combination of genetic and environmental factors, but the exact cause of eczema is still unknown. So, eczema can be transmitted in families, but it cannot be caught from another infected person. When an irritant or an allergen from outside or inside the body switches on the immune system, it produces inflammation. And it is this inflammation that causes the symptoms common to most types of eczemas. Now let us look at the symptoms of eczema. The most important thing to remember is that eczema and its symptoms are different for everyone. Your eczema may not look the same on you as it does on another patient. Eczemas are usually itchy and the itch can range from mild to moderate. In some cases, it becomes much worse and people keep on scratching. This scratching leads to formation of chemical messengers in the body which aggravate the eczema and lead to more itchy sensation, and thus an itch scratch cycle develops which has to be broken to help the patient get relief from this condition. The other symptoms of eczema depend on the duration of the disease and the persistence of this itch scratch cycle. In early or acute eczema, the prominent symptoms are redness, swelling, and small fluid filled lesions. There may be moistness and discharge, which gives a weepy skin condition with intense itching. Gradually, as the disease advances, redness and fluid discharge are reduced, but the scales start appearing on the skin. And in the chronic form, the skin becomes thick, pigmented, and leathery, and it sometimes becomes crusted also. Now let's have a few words on the specific types of eczemas. The atopic dermatitis, it usually starts in infantile stage and it presents with weeping and fluid filled lesions involving the face, trunk, and the outer surface of the limbs. During childhood, the lesions become dry and eroded, and they involve the inner surfaces of the folds like the elbow, the knees, and the wrist. And during adulthood, while the distribution remains on the inner surfaces like that on the folds itself, but they tend to be thick and crusted. Now the Savory dermatitis. In Savory dermatitis, the patches are red, scaly and moist. They are present on the scalp, ears, eyebrow, sides of the nose and beard area. It initially presents at infantile stage and then later at the adolescence. The patches of discoid eczema are single or multiple, coin shaped, fluid filled or scaly, itchy and are present mostly on the extremities, that is on the legs and sometimes on the trunk also. The photoallergic reactions are usually present on the exposed areas of the skin like face, the collar and V of the neck and below the end of the sleeves. Now, besides these various varieties, there may be certain seasonal flare up of these symptoms, or sometimes they may be spontaneous remission. Many times, non-eczematous diseases mimic eczema and vice versa. The best way to find out whether you have an eczema or not and how to tackle this condition is to consult a medical professional who can look at your skin and make a correct diagnosis and treat you. I hope this discussion might have helped you in understanding the eczemas in a better way. For any further details which are beyond the scope of this talk, I advise you to meet your dermatologist who will be more than happy to help and guide you. Thank you.